Hi everyone. Oh, forgot the light. Hi everyone. Welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance, the acupuncturist. Well, today live topic is how is chest pain diagnosed? How is chest pain diagnosed? Hi, happy day. So if you here on this live, please say hello and just type hello and what else, and share this live video on your social media. If you're on Facebook or Instagram, please share this live video. I'm going to share on Facebook as well, so thank you. Yep, I'm going to share right now. Hi Veronica, how are you? Go back to Instagram. Okay, and Instagram, I'm pretty sure you can share on Instagram as well. And how do we do this? On Instagram, you say, you can type something, and then I'm pretty good, thank you. Yeah, so this is live, and if you're watching replay, you can fast forward to the next 5 minutes. Forward to the next 5 minutes. Just see. I can invite. I'm just trying new thing on Instagram. Let's see whether it works or not. Share a photo or video with the viewer. Not this is. Okay. I'm just trying out a new thing on Instagram. But anyway, it's good then. Alright. Let's get into our topic. So how do you diagnose chest pain? Whether it's from the heart, lung, or whatever, you see. So the symptoms that we discussed yesterday, what symptom may occur with chest pain. So with those symptoms that occur with chest pain, you basically could tell where it come from. You can make a primary diagnose. But unfortunately, if you want to make a proper diagnose, make the right diagnose, it may not good enough. You may need some lab tests, especially when it comes to heart. When it comes to heart or lung, So let's say, is this patient coming with chest pain? And they said, well, I have chest pain also, and you ask all the questions, you find out they have sour taste in the mouth, and they get chest pain when they're hungry, or they have bloating in the stomach. Then we're pretty sure this case actually the chest pain came from stomach, the acid reflux, or the ulcer that causing the pain of the chest. So in this case, you don't have to worry about the heart, you see, and I won't bother to do the heart further investigation on the heart, okay, because they always happen with sour or burning in the chest, and this is acid reflux issues. Now, if the patient say, well, I have upper back pain, upper back pain, then the pain is actually from here to here, to your chest. Then this could be heart as well as the spine problem, the upper back pain issues, and no injury, just the spine problem. Then yes, because pain from the chest to the upper back to the chest, it could be from the heart. and it could be from the upper back as well. Then therefore we need a further investigation to rule out whether it's from heart. If we rule out the heart problem, then we know it's just the spine issue, it's the upper back causing the pain in the chest. Well, I hope this makes sense. So the previews, like yesterday, we discussed about all the symptoms. They are quite important when it comes to chest pain, right? So especially in the heart problem, then we want to know whether it's a heart attack, angina. What do? We need to do a further investigation. If you're a patient, you need to go to emergency immediately if you think you may be having a heart attack, and especially if your chest is new, unexplained, or lasts more than a few moments. Does it make sense? Yeah. Okay. Now, if you go to emergency, your doctor may ask you a lot of questions, just like all this question that we mentioned all yesterday, right? So you have to be prepared to be to share your information, and if you're on a lot of medication, you need to bring all the medication or put it in a list with you. Go to emergency, because you want to let doctor know about your medication, because some medication side effect is chest pain. Right, this is all about chest pain. When you go to emergency, you need all this thing. Okay, now let's talk about diagnostic tests. So with chest pain, especially we think, wow, this is may relate to our heart, then the doctor may order some further tests to help you to diagnose, to find out whether it's from the heart or not. Okay. Hang on. What is this going on here? Okay, some platforms, but okay. Hi Ali, how are you? I'm good, thank you. Good to see you too. Okay, now keep going. So what are the tests? ECG, an electrocardiogram, which records your heart electrical activities. Well, I will tell you, most of the time it didn't pick up anything. Okay, therefore now in New Zealand they may suggest you do a 24 hours, you carry it on to 24 hours, it tests your heart electrical activities. And some patients complain it's very uncomfortable when they put it there, because you're not it take a while to get used to it. Something that you carry on there and you bend it into your body and to your heart and check your heart activities. And I have a lot of patients say that they didn't pick up anything. So far, all my patients, they had this problem. They haven't picked up anything yet. For those that pick up things, they pick up in the hospital. Quickly in hospital, they just pick it up. But not when they put it on 24 hours. Yeah, I haven't had any cases in my memory at the moment that when they put it 24 hours, they actually got diagnosed of heart problem. Well, why is that? It's difficult in here too, because your heart electrical activities out of balance. It may just come with chest pain. When you had chest pain, when it happened, and it's out of balance. When it's no, it's normal, and you don't get your chest pain all the time. It may come once a week. It may come once a month. It may come several times a week, but while you checking your get your ECG, it didn't happen, so it didn't pick it up. So this is not the only test that you get. Okay, what else do you get? You should order, your doctor may order a blood test for you. What's blood test doing? Blood test measure enzyme levels. Blood test can tell whether you have high cholesterol or not. But the simple thing is, in the clinic, we'll straight away get your blood pressure test, right? So blood test can show your cholesterol as well, to see whether it's cholesterol high or not. Okay, there's a lot. Blood test can tell whether there's an infection or not. You know, can look at the white blood cell, whether it's high or not. And blood test can tell more and more things. So blood test is a very basic when it comes to the diagnostic test, very basic test. Chest X-ray, which is used to examine your heart, your lungs, and blood vessels. So the chest X-ray can tell whether your lungs good or not, your heart, as well as your blood vessel. An echocardiogram. An echocardiogram is use sound waves to record moving image of your heart. So that's another one. An MRI, which is used to look for damage to the heart. You know, MRI can look at your soft tissue in the chest as well, the muscle in here. They look at your lung as well, and it can look at the bone as well, and your spine. You know, the spine over here. The MRI can tell whether there's this problem pop up that compress the nerve. So MRI can tell all this. Stress tests, which are used to make sure your heart function after exertions. Right. This is all important. And there's another called angiogram, which is used to look for blockage in specific arteries. So we have a lot of different tests that would help to diagnose whether the pain is from the heart, lung, or the muscle or the spine. But more tests are actually there to look at the heart problem. For the heart problem, why is that? Because any chest pain come in, if you worry about it, you should run all those tests to rule out the heart problem. The more common one is blood tests and ECG when it comes to chest pain. Not necessarily give you MRI, depending on your symptoms. Okay, and your if you have a injury in your upper back and they're causing chest pain, then they may give you a spine MRI. Does it make sense? Okay. We don't normally do CT scan on the heart though. Yeah. So more common with some of with the special thing for your for the artery. It generally it do, what do you call it? It actually insert some, what we call, not actually color, what we call 照影剂. I can't remember how to say that. 照影剂. The 照影剂 is for CT scan, can done for heart as well, and 照影剂 means it color the blood, and they can have a look and see whether when the color go to the blood and if it's blocked, and then you can see that it blocked in some way, it can't go through, and how many it go through. Let's check the artery one. Yeah, so they have to insert injection something into your things. Yeah, the CT scan is the angiogram is the CT scan, what we call it. It is a type of angiogram. The last one that I yeah, for the blockage one, that's a type of CT actually. Yeah, it is. It can CT scan and MRI is a bit different. It's more sometimes CT scan is important because it can tell the tumor. I think they are very rare, that tumor cancer in the heart. Okay, but I have friend died 2 years ago. Actually, had a bone cancer, and we transfer to lung and heart as well, and it's quite big. It's amazing that he extend his life for 2 years. It was about 3 months, and he vomiting a lot of blood and all those things. Yeah, and we lost him in the end. But yeah, CT scan, heart CT scan is a very common test as well. Depending on the symptoms though, because this CT scan can tell the structure of the heart and the blood vessel. Yeah, more important the blood vessel, because a lot of people need that kind of thing. Yeah, CT scan is one of them. Okay. Yeah, that's it for today. Okay. But more common is ECG. But I have a lot of people do patients do ECG, but they couldn't pick up anything. Most of the time they couldn't pick up anything, especially for the 24-hour one. And then all the elderly patients that once they have chest pain and they have to do ECG, then they went to hospital and they did the ECG there and there's nothing, and then they came home with a machine for 24 hours, carry on with ECG and nothing, and I haven't seen any of my patients pick up things from 24 hours. Okay. Then, which means it gives me an idea that it's not. I asked them why didn't give you more than that for a week. If look at it, it did make sense for me. And here, if you get chest pain once a week or 2 or 3 times a week, it happened weekly, not daily. If it happened daily, then ECG for 24 hours, it makes sense of it. If it happened weekly, then you just wait for 24 hours. It doesn't make sense, because if it happened weekly, you should put it on weekly. Does it make sense? Yeah. Well, this is just my idea, and I don't know about. Maybe there's other reason too. I'm not sure. But anyway, thank you very much for being here, and I'll see you tomorrow. Bye bye. And let's talk about what are we going to cover tomorrow. Tomorrow we're going to talk about the treatment. So tomorrow we're going to talk about the treatment. We're going to talk about acupuncture treatment. Then let's talk about acupuncture treatment tomorrow. Okay. For chest pain. Okay. And we'll give you some acupuncture point. Then further on we're gonna talk about acupressure point. That for if you're non-acupuncturist, then you can choose to use acupressure point. But if you're acupuncturist, tomorrow is your day, because I'm going to show you acupuncture point strategy that you can choose to treat chest pain, that including lung problem, stomach problem, and heart problem. Okay. Stay awesome, and I'll see you tomorrow. Bye bye.